Good evening, ladies and gentlemen, and welcome to this new episode of the new TV program Cast. And we would like to welcome today Dr. Abir Al-Ali. Dr. Abir Al-Ali, she is a specialist of ear, nose, and throat. Dr. Abir Al-Ali had the French Board of ENT and the Canadian Fellowship in Pediatric ENT. Welcome, Dr. Abir.
Thank you so much. Thank you for having me.
We are so honored to have you today. So, welcome again to the TV program, and we would like to discuss the latest updates in the ENT, especially those who are related to the patient's life.
Thank you so much. I'm happy to be here and hope I could be of help for those who are listening and watching us today.
Yes, certainly. Dr. Abir, let's discuss something that is very common in our society, which is the obstructive sleep apnea.
Yes.
So, how could you explain for our dear viewers the sleep apnea?
Okay, so obstructive sleep apnea, it is a part of a spectrum of a disease which we call sleep disordered breathing. This means that there are events that occur during the deep sleep or when
Mhm.
the baby is in deep sleep. The spectrum could range from simple snoring or the most severe form, which is obstructive sleep apnea, meaning that there are obstructive episodes that occur in the upper airway, which causes, as a consequence, for the oxygen saturation to go down. And therefore, as a physiological response, the baby will wake up. And then, in order for the baby to have
Enough air.
enough air, or let's say to have a good breathing again, which this, as a consequence, will cause interrupted sleep. And when this occurs, obviously, it's, let's say, not healthy for the child because every human being, including kids, need a full, continuous, deep sleep for them to be able to recover and function in school and have normal development, normal school performance and whatnot.
Okay, you brought me up with two new questions actually. So,
Yeah.
as you repeated the term kids or the children, is it
Yes.
only affecting the children or can affect the adults as well?
No, obviously it can affect adults.
Okay, and
Yes.
how can that symptoms of sleep apnea differs from any other sleep disorders symptoms?
Well, in children, they present differently. So
Mm.
kids who have obstructive sleep apnea usually have symptoms of what would resemble attention deficit, hyperactivity, poor feeding, or excessive feeding.
Mhm.
Believe it or not, a lot of them have enuresis, meaning that they could, wet their beds again at night,
Yeah, this is
even 8, 7 years old.
mm,
We see those cases. They could have symptoms as well of, poor school performance, delayed in their school performance. However, in adults, it's completely different. They present with symptoms of cardiovascular diseases
that's
in
great.
adults.
Now, you greatly mentioned the symptoms of the sleep apnea and
Mhm,
how will it affect the sleep pattern of the children, but
mhm.
how can that affect the daily life of the children?
Well, obviously, if they're not sleeping well and they're not performing good in school or they're hyperactive, so it will definitely affect their development.
Oh, that's great.
Yeah.
Then, do we have any like treatment or solution for that problem for the kids?
Yes, absolutely. Once it is diagnosed,
Hmm.
meaning
Is it
that we
easily
confirm
diagnosed?
it is most cases the diagnosis is made by history,
Hmm.
just taking history from the mother or the
Is there
caregiver.
like any tests or something you do, like
We do
sleep
test,
studies?
absolutely. We do sleep studies, but those are for a selected group of patients.
Hmm.
We don't need to do sleep study on everybody. So, but the majority of an otherwise healthy, normal child, just history taking and physical examination is enough to make the
Great.
diagnosis.
Is there like any certain techniques to use to have a good sleep for the children, or you sometimes try to give some medications for the children?
Medications I don't usually give for those who have a clear obstructive sleep apnea
Hmm.
because again the consequences for such for the apneas are severe because again it will affect the school the performance and development of the kid, and this is something important that we cannot delay.
Yeah.
So as soon as the parent tells me that the patient or that they see their kid with pauses at night and there are cessations of breathing and obstructive events, then I don't wait. I just, make my diagnosis and book the patient for surgery, actually for an adenotonsillectomy.
That's great. Now, we normally with the adults, if they are having any problems with their sleeping pattern, we hear the term CPAP, which is the continuous positive
Absolutely.
The continuous positive airway pressure, is it? Is it like a
CPAP, continuous positive
airway
airway
pressure?
pressure,
Yeah,
yes.
which is like a kind of advice that is used during the sleeping time to help them have a good sleep. Can we
Yes,
use the same device for the kids as well if
definitely.
needed?
Yes.
Yeah.
But again, for a normal, healthy child
Mm-hmm.
who is non-syndromic, usually the first line of management for these cases, according to the American guidelines, are adenotonsillectomy.
No, that's great.
And if there's any failure, or let's say if cases who are syndromic and we know that uh, they have to start with CPAP, we usually start them in CPAP, and then we could do the surgery after the initiation of CPAP therapy.
Yeah, but we can believe that some parents may not notice like any symptoms of the child, especially when they are sleeping. So how do you give an advice for the parents or the caregiver of any children that if you see that symptoms in the patient or in the children, obviously, and if you hear like some strange sounds, just bring them immediately to the doctor to diagnose.
No, no, it's not strange sounds. I mean, because snoring is a sound,
Yeah,
right? And it's considered acceptable.
yeah. But
If the
sometimes they
patient
consider it as well as strange.
but again, if obviously we're always here for the parents if they have any concerns or questions.
Hmm.
But let's say if the mother is suspicious and she's not aware of what's going on, and she notices that the child is maybe not very active in the day, or
Yeah.
maybe hyperactive, or not doing good in school, if the baby or the patient started wetting his bed again, and then I would ask for mom to go in the room while the baby is or the kid is sleeping after deep sleep. So let's say the kid goes to sleep in the room, go after 20, 30 minutes. So
Hmm.
the baby, hopefully, or the kid is in deep sleep.
Hmm.
And then just to wait for a few minutes, 10, 15 minutes, and to observe if there is any snoring or if there are pauses. And I usually ask the parents also to video for me
Hmm.
so that they could come on the next visit and I could see the video, appreciate the sounds, appreciate if there are any obstructive events. And usually also studies surprisingly showed that even those videos have a high sensitivity.
Hmm.
So just looking at the video, we can make a diagnosis and right away book the kid for surgery if
Okay,
needed.
that's great. One more last question before
Mm.
we end up our session. Now, if the parents are somehow ignorant and they ignore these symptoms,
Mhm.
if they become late to diagnose the patient, to what extremity we believe the patient would reach of sleep apnea? Will that be complicated in the future for them?
In terms of complications, well, I mean, we know again, obstructive sleep apnea has severity,
Hmm.
right? So we could have mild obstructive sleep apnea, moderate or severe.
Yeah.
And this is something that we can never know without doing a sleep study. And again, the sleep studies are kept for those who are syndromic and there's a criteria.
Hmm.
However, usually it's something that we have to be vigilant about.
Yeah.
Usually, again, obviously, if things don't, or let's say are not treated early, they could progress again. And when we talk about kids, they're not going to go into cardiovascular diseases right away, but
Yeah.
again, they're going to have trouble with their school and development. And this is something serious, obviously.
Yeah.
So, no, I do urge the parents if they have any doubts or any observation that they see on their kids, that they have to confirm it.
That's fine, Dr. Abir. We are so glad to have you in our first episode of Midcast, and hopefully we can see you later with a new subject as well.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of our first segment of Midcast. Thank you for watching us this episode of Midcast. We hope you found today's discussion insightful, empowering. Remember, staying informed is the first step toward better health and well-being. Until next time, stay curious, stay healthy, and stay tuned to Midcast, where we meet healthcare professionals to know your health better. Take care, and we'll see you in the next episode.